And I hear frustrations about the healthcare system or an experience that they had, or gosh, I just feel like I'm a number. The doctor's in and out in a matter of minutes, sometimes even less than that. And then, oh, but here's your bill. Hear a lot of these common complaints right here locally. Hey, have you ever heard of HELPcare Clinic or direct primary care? And it's just a great door opener. That's somebody that's seeking for something better.
Hey everyone, welcome to Take Charge with Healthcare. And this time with my host Dan Hinman, I'm glad to welcome Kelly Connaughty, who's with HealthMarkets. And he's also in my BNI business networking group. And for the last almost 2 years now, the last 2 years of open enrollment seasons, has been my chief advisor as we've brought him in when we've had open houses for our members and for others interested in membership at HELPcare Clinic, to talk with Kelly as a licensed insurance agent, to be able to have him give them advice in terms of how HealthCare Clinic membership fits with a health insurance plan, how they can be smart about their choices, whether they have employer-provided insurance or whether they're going through the exchanges or they have some other need. So Kelly, really glad to have you. It's been great working these last few weeks anyway, as we've had these open houses. I thought it'd be really great now, as there's still some time with open enrollment season for a lot of people, especially in the Medicare and the MnSure exchanges, for people to be making decisions about their health insurance, and thought this would be a great way for you to do some education for us.
Yeah, thanks a lot, Lee. Definitely a pleasure to be on this call. It's been great to get to know you. It's been great learning more about direct primary care, and that topic has been coming up so much more now with my clients as I've gotten more educated in this space as well. And this has been an interesting open enrollment. Most people are hearing on the news a lot of various different information, from Medicare Advantage plans pulling out of entire states, entire counties, losing certain medical providers. So just to kind of highlight a few of those, so let's talk about Medicare Advantage for a moment. Blue Cross, for instance, would offer a couple lower cost plans, and they'd be 44 or 144 a month. They pulled those lower cost plans here in Olmsted County, just to use an example, and it's most of Southeast, but they're leaving all their clients with a $248 a month option. And take it or leave it, here's your option, or shop somewhere else. So that's one scenario. Well, Olmsted County also saw a change with Humana in their Medicare Advantage plan. And for those on Humana, we're all getting letters this fall stating, by the way, Mayo Clinic is no longer in network. Okay. So now if you utilize Mayo Clinic, you need to shop for something else. And then also the big one that's over 150,000 people here in Minnesota receiving letters from UCare stating, hey, we're no longer going to support Medicare Advantage. So they're left with shopping for other plans. And of course, they're offering typically a $0 plan option. So that is a lot of clients and future clients of mine that were affected by that. I was getting a lot of calls, getting a lot of referrals saying, hey, we got somebody here that is very distraught, or they're concerned. They're trying to find out, what plans can they actually get. Well, in Olmsted County, there's basically 3 carriers now, because United Healthcare also pulled out of majority of counties. So, so that's been very challenging, just going over these options, and no longer a $0 premium option being available, and finding one that's going to cover their doctors and cover all their needs that they typically had before. And that's in the Medicare Advantage space. And then you also
So you talked about,
go ahead.
related to that, so you've talked about the Medicare. What about in the sort of the exchange plans, the MnSure exchanges? How are things different this year for those?
Definitely. So for the last 4 or 5 years, from the Inflation Reduction Act, they enhanced tax subsidies, and that was set to sunset at the end of this year. So that's where a lot of this big battle that we're seeing with the shutdown. And And so everyone's kind of anticipating, are they going to expand that for one more year? Are they going to extend it? What are all the, um, what's going to end up with that? So as of right now, it is still going to sunset. So when I'm sitting down with my clients, there's now in 2026 going to be a cliff back for qualifying for these tax credits. Okay. So that's one of the big changes. So it's very important that I'm doing reviews with families, couples, individuals on, hey, if you're utilizing these tax credits, where is your income going to be at? And then also going forward to 2026, where are you going to be at for your income? So that is very important because there are repercussions to if your income goes over that cliff and you're utilizing tax credits, then you have to pay those back if you're over that level. So that is a very important aspect to make sure I'm educating everyone as well. Another aspect too is just the premium increases. So higher than usual premium increases are happening. So just one example, when August came around, all these insurance companies are starting to enter in their rate filing increases that they're anticipating the state to approve. Medica was on that list of having a 30% average increase across the state. So just to kind of put that in perspective, if you have a plan here in 2025 plan year and you're paying 1,000 a month, you can now anticipate just in 1 year when this renewal comes up that you're going to have roughly about a $300 per month increase going into 2026. And in a lot of these reviews, that is roughly about the increases that have been occurring. So Blue Cross is another big one here in Olmsted County. They averaged about a 15 to 18% increase, and they're all pretty much right in that ballpark. You go anywhere across the state, Health Partners, all these carriers are seeing in the upper teens to mid 20% increases. And that's been a big concern. So you add those two things come together. Enhanced tax credits going away is going to have an impact on where they were the previous year. And then, of course, those are just going on or off the marketplace, buying their health plan, just the increase of the plan itself.
So what would you say is the good news for people this year? So
Yes.
we've talked about a couple of the bad things. What are some of the good things, or what's at least one good thing?
Yes, there are definitely good things as well. So that, I'm one of those that likes to start off with some of the bad news. Here's some of the items that we're hearing about on the news and things like that. The good news, though, is enhancements in the health savings account area. So through the bill here earlier this year, they enhanced those. And I've been having a lot of conversations with my clients about this. So what are one of those enhancements is all bronze plans on the marketplace are now HSA compatible. And that's great. So I had a lot of clients already that were on bronze plans. They weren't on the designated HSA compatible plan. I can now give them news. Just so you know, your plan is now HSA compatible. You can now contribute and get the benefits of having a health savings account. So that's definitely a positive. Another
That
positive.
also, just one thing related to that, that also then gives them a chance to manage a little bit more that how close they get to the cliff, right?
Yes.
Because if they can contribute money into the health savings account, that pushes them back to a lower income so that then they would continue to qualify for the tax credits.
Correct. Yes. So that's a big part of our conversation is using that, educating them that, hey, this is a tool. You're really close to this level. This is a tool that we can use to keep your income under those thresholds, continue to receive those subsidies. And yeah, absolutely is a very important part. And one of the other things that was definitely exciting for me, I know is exciting for you too, Lee, is direct primary care now being compatible for HSAs as well, so you can pay your membership utilizing an HSA. And this has been an increase in my conversations with my clients as well, educating them and even just starting that conversation about, do you even know what direct primary care is? And it's brought very good educating about that option is now here in Rochester and Austin as well. And that's been a huge positive in my view.
So I want to leave something so Dan can chime in with.
Well, I was going to say not only Rochester and Austin, but we've got the new clinic coming on board as well.
Yes, yes, that is very exciting.
So
It's
really
been
excited about that.
absolutely, absolutely.
So Kelly, how about explaining to us a little bit about how we can actually apply HSAs to these two new opportunities?
One of the things I want to share too is how I've utilized with my clients and sharing, coordinating with those that are utilizing HELPcare Clinic with Lee along with these plans. So for instance, I had a client last fall where they're on a silver plan, paying a higher premium because they wanted the lower deductible. And one of the things that they shared with me was, gosh, we go to Mayo Clinic, but every time we go there, it just feels like we're just a number. Okay. And this was a great opportunity for me to ask them, hey, do you know what direct primary care is? You ever heard of HealthCare Clinic? And no, I have not. So talked about the concept, and this is going back to last fall when we had these open houses and had this couple attend one of these open houses and get educated, and they absolutely love the concept of it. It fit their beliefs on how they believe they should be getting care, the 30 minutes to an hour with your primary doctor. They couldn't be more happy with this being an option that they didn't know about. So when I'm sitting down with somebody and they have a silver plan, like in their scenario, what we were able to do is to save them a lot of money. And it was a conversation where like, hey, you're paying this much for a silver plan, over 400 or 500 more per month. If you utilize HealthCare Clinic, that's where you're going to get all your direct primary care now. We can move you down to this bronze plan, save you 400 or 500 a month, about 6,000 in a year. And now you have a membership, and and they absolutely love the idea. Let's do this. Let's do this for a year. Well, fast forward a whole year now, they're absolutely loving HealthCare Clinic. They're getting the care that they need. Okay. Well, now with these enhancements with the HSAs and applying to all the bronze plans, they're able to now utilize their membership as a qualified expense, which is now going to lower their taxable income. And it just adds more benefit to that. And my conversations can be more in educating these extra options that they didn't know that they had from before. So that's one area too that I've been having great conversations that have brought about more opportunities. So
Well, and so if they're already saving $400 to $500 versus silver and getting bronze instead, then the other part is that because they're able to pay for it out of their HSA, that's if they're in a 20% tax bracket, that's again making it 20% less expensive to use their membership too, right?
correct. Absolutely.
Two big advantages there. That's really nice. What's the typical way you approach healthcare insurance generally when you sit down with a client? What's kind of the umbrella story you tell them as they're trying to make these decisions?
Yeah, definitely. So I primarily deal with the individual thing. So a lot of my clients are coming from, hey, I just lost work employer sponsored coverage. I started a business. I need health insurance. That's a common client of mine. Another common client is just that bridge in the gap for the next 3 to 6 months when they lost their employer sponsored coverage is a common one. And then another common client is we're offered group coverage, but to add my spouse and kids is going to cost 1,000, 1,200 a month. And that's a great conversation that enters me as well, because we're a number 2 state for this scenario. And it's called the family glitch. And it costs, for the employee themselves, they can get their group coverage and save, get a good rate, but to add the rest of the family, it costs a fortune. And so how do these conversations, start? At first, it's gathering information. What plan do you have? What are you being offered? What's that deductible? What kind of care do you need? And I don't just get their name, number, birthday, and then here's your rates. I dig into what their primary needs are. Are you an individual who just needs coverage, you go to the doctor once a year, or are you somebody that has a specialist, or are you having repeated visits? I also ask, do we have any prescriptions that we want to run through a typical formulary to make sure that they're covered? And I'm writing all this down, getting all this information. And then what I do as a broker is now shop for them based off of these needs. And also what they're used to having. It's always a great gauge to where their expectations of coverage at. And so now you just kind of piece all that together, and myself and my client, we work together and get to that bullseye to hopefully meet their needs, meet the budget. That's also a very important aspect of it as well. And now go shop. So I utilize MnSure, and then of course we get into income. That can be a huge factor in being part of the savings if they qualify for tax credits. So, and that's an important part of our process as well. Doing the application, I do it in person or online. Sometimes we'll hop on a Zoom if they're savvy with that. We'll do it right there and do the MnSure application together. I'm an assister. And yeah, I try to be as hands-on as possible. It's one of my biggest things I hear from my clients is how they appreciate how hands-on I am with the process.
It's a great approach. What I wonder is, how are people responding to these 20% to 30% increases? I mean, are you feeling like people are getting kind of hopeless out there, or what reaction are you getting?
Some cases, yes, there definitely is some of those. There's others. It's like, well, what is new? Insurance going up, healthcare going up. That you have a lot of those. They're just their hands are already up. They've heard. They're prepared. And all right, tell me the news. What's this? What are we looking at now? And all right, well, here's where we're at. Yeah, yeah. So there's some of that, and then there's other situations. Yeah, I brought up the Medicare Advantage space. I've had some clients where they have some pretty intense medications and various things. And when you only have very limited options, that can bring up some concerns on making sure we get everything covered. And those are some of the most unfun situations when you run into that. Now you're really trying to problem solve, and you're trying to find any resource you can to help them out.
I think one of the things I really appreciate about working with Kelly and with other MnSure assisters is that you guys are not paid by the client. You're paid actually through MnSure, paid through by the insurance companies. So there's no cost, there's no extra cost for using you. And so if someone is watching this and is on a MnSure plan or considering a MnSure plan, and you don't currently have an assister, I would say by all means get an assister, because it doesn't cost you anything, and all you do is gain by having somebody who's been through this a lot more often, a lot more frequently, and able to really help you navigate through the system.
Yes, correct. Yep. And in general, how do I get paid is, assuming I'm helping an individual navigate this properly and find the proper care, and they feel good about it and enroll. How I get paid is actually from the carrier directly after the enrollment. It's not reflected in anyone's premium. So you can go shop on your own, and here's your premium, and utilize myself as a free resource. It's going to be the same premium.
Hopefully you'll help them find a better one, a better option. You'll help them find the
option.
best option where they can pay that same premium.
When we think of direct primary care with HealthCare Clinic, Kelly, what is kind of the ideal customer for that product?
Yes. As far as direct primary care, Dan?
Yeah.
Yeah. Somebody I think that example I shared is something I always listen for, because I get in sometimes some pretty deep conversations with my clients. And when I hear frustrations about the healthcare system, or an experience that they had, or gosh, I just feel like I'm a number. The doctor's in and out in a matter of minutes, sometimes even less than that. And then, oh, but here's your bill. And I'll hear a lot of these common complaints right here locally. And that is a great person to bring up something like, hey, have you ever heard of HELPcare Clinic or direct primary care? And it's just a great door opener. That's somebody that's seeking for something better.
Well, yeah, I think as you mentioned, if you've got somebody who's been accustomed to paying for a silver plan, and they've had this fixed amount already, the fact that they can switch to a bronze and apply those savings toward actually getting the care versus just having paid for more insurance where you're going to still have more out-of-pocket expense. I think, people who are looking for that kind of value is a really good thing too.
Yeah, absolutely. Yeah, I'll catch people they're on gold plans. They're thinking, hey, $1,200 deductible. They go to the doctor once per year, or a silver plan. Absolutely. Let's move them. Let's move them down to a bronze. Let's utilize better care. Yeah, like you said, that is a great candidate as well.
So I just want to say thanks, Kelly. First of all, thanks for all that you have done through the times when we've been having our open enrollment open houses and all the good advice that you've given people. I've sent lots of folks your way. They're saying, I like HELPcare Clinic membership. I want to do this, but how does it fit with my covering the catastrophic kind of concerns? And so having somebody who's really knowledgeable and really understands how to pick the best plans that pair well with our membership has been great. But mainly just the way you talked about how you spend time with people, kind of like we do in the clinic. You spend time really understanding their situation. I've seen it happen, numerous times where you've been able to help people find ways to save and really get the kind of care and coverage they need. So thanks for what you do. Thanks for being with us today. And we look forward to having more people able to hear about this.
Yeah, it's been great to meet with you today, Kelly.
Thank you, Dan and Lee. And yeah, thanks for having me on here. It's been such a pleasure getting to know you and your practice. And yeah, it's been great. I appreciate it a lot, Lee.
All right. Thanks. Join us again for the next time with Take Charge with HealthCare.
Thanks for joining us. If you enjoyed this episode, be sure to leave a comment or a review and to subscribe on Spotify, Apple Podcasts, or on YouTube. And also to share Take Charge with HealthCare with your friends and on your social media channels. At HealthCare, our passion is helping people take charge of their health and their health care, helping employers take charge of their health plan expenses, and helping physicians and other practitioners take charge of their healthcare careers. Learn more about the HELPcare Clinic difference at helpcare.health.